Hello, hello, hello. Are you was? Hello, hello. Hello. Are you was? Hello, 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 hello,
Bismillah Rahman Rahim. We will begin this session now. I'll request Dr. Somia Iqtidar to recite a few verses from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد صدق الله العظيم.
This is a prelude to the Women Leadership Program. That is why I chose Somia for the recitation. So we are going to begin the session very shortly. I'll request the honorable panel members to come on the left side. I'll request Usman Khalid Wahid Sahab to join here. Captain Iqbal Sahab, Tahir Sahab from Searle. High Q say Captain Iqbal. Tahir Sahab, aap bhi aa jaye. I request Dr. Khurram, who is representing guests, to be there. And we'll need a chair over there for Madam Shaila Javed Akram. She is an entrepreneur and runs a pharmaceutical industry. तशरीफ रखें जी, मैं चेयर लगवाता हूँ मैम आपके लिए. Professor Javed Akram has just entered. We are waiting for the chief guest. As soon as he comes, we will start with the regular proceedings. I'm very grateful to all the distinguished guests who have joined us here this afternoon, this early evening. We had a kickoff of the conference by
Hello, hello.
Let me make an announcement. Please be seated. We are going to start shortly. First, we are going to have an open mic session with the Federal Minister of Health, who is here. And we are very lucky to have some giants of pharmaceutical industry who are sat here on the left side. And we hope to have a very meaningful dialogue between them and the Minister for Health. The objective is obviously improvements in the health system. I also welcome Professor Rizwan Taj, President of Pakistan Medical and Dental Council, and I request you to be on the stage, sir. आप ही का इंतजार है जब तक मिनिस्टर साहब नहीं आते तब तक. So I've seen all of these people, the giants which I said have been deliberating, and we will request to hear from you as well. So if one of you can tell us what are your plans and how do you want to proceed with the dialogue. So if any one of you can please briefly tell us. The minister is going to join very shortly.
First of all, we're extremely grateful to PSI for the
और ऊंचा करें.
Is this better? Yeah. So first of all, on behalf of my colleagues, I would like to express our gratitude to the PSIM, this very new but very important society that has taken over the reins of many important projects in Pakistan around healthcare, which is a key human right. I think to deliberate, perhaps we would need the Minister Saab's presence because all of the issues that need to be discussed will, relate to him and the work that the government is doing somehow. So,
okay, thank you. So they are all ready for the minister to come, and we are also waiting and hoping that he will join very shortly. I will also take this opportunity to welcome our distinguished foreign faculty who have arrived here. Professor Uppal Disanaike from Sri Lanka is here. Professor Leo Yi Sin from Singapore, she has also arrived. And Dr. Adil Ajwad Bhatt, he is also here from USA. We are all delighted to have you and amongst us, and we look forward to a meaningful scientific program which will kick off tomorrow morning. In the meanwhile, I'll ask Professor Javed Akram Saab to make comments about what Usman Khalid Waheed said about PSIM making this initiative, and we really hope something good will come out of it. Sir.
Bismillah ar-Rahman ar-Rahim. Thank you so much, Aftab, for the opportunity. It's my very, very proud pleasure to welcome everybody over here. I think whether we are a pharmaceutical manufacturer or marketing or prescriber or regulatory, I think this room has everybody represented for patient. We are obviously, the patient remains on the as a center piece for all of us. We are a whole life, whether we are producing drugs or we are prescribing drugs, our concern is the patient must get the best. We are obviously, we remain patient-centric. Lately, unfortunately, our country has been going through a turmoil, a financial turmoil, and a political instability, and very difficult times that we are going through. And as a result, many life-saving drugs have vanished from the market. And that is extremely important. If we can't address it now in this room, it can never be addressed. I know it's very difficult to get hold of anti-tubercular drugs, very difficult to get anticoagulation for heparin, including even insulin is very difficult. I'm grateful to some companies like Getz for importing and reconstituting it in Pakistan. Still, their insulin is available. Similarly, I think another issue that in the province of Punjab face, and I think Nadeem Jan Sahib is on his way and he will tell you about the federal government, because as a provincial government, we are facing defaults on part of companies which were committed to supply, because we entered into tender long time ago. At that time, there was the dollar parity wasn't that bad. So they had won the tender, whether it was hepatitis drugs, antiviral drugs, or whatever. But then it became very difficult, and we absolutely fully understand their difficulties, because they are not charity organizations, they are for profit, and we don't expect them to put money from their pocket and honor the commitment which they have done. So what we have already done after negotiation with all the companies, myself, I negotiated with them for a very long time. And what we have done, we have said, we have put up an unofficial line that you have supply 70% and we retender it. We can't increase the price because there is a competitive process. The court in 1 second will strike it off. So what we did, you supply 70% to Punjab government, and we will consider that you have supplied, and we will retender the same molecule, same device, or same stent, or whatever you have committed. So we are trying to really negotiate, because if we start penalizing or blacklisting our companies, then probably we will be shortfall of companies and our purchases will be in huge difficulties. So we do understand, and today the objective is that how we, despite all the difficulties, how can we stand for the patient, especially ensuring they have uninterrupted supply of medicine, devices, things like that. We have to somehow find a way. Punjab government, since I am part of it, so I have no issue, because I can assure on part of Punjab government that whatever we can do, we will do that, because I think we have the best pharmaceutical companies in Pakistan. They do, and they are all humane. Once we ask them for donations when we are struck by floods or everything, we get more than we expect. So that's not issue, but I think even now the situation is worse than flooding or earthquakes and things like that. So that needs to be addressed. I think while we are waiting for the health minister, Saab, we can address this, because right now, I think for our foreign colleagues coming in, right now I have a responsibility to be health minister of the province of Punjab, which is 70% of Pakistan. And also I am the health minister of medical education. I am also a minister for social welfare and also Baitul Mal. So social welfare and Baitul Mal, it's very much mandate also of continuing to provide essential medicines uninterrupted to our patients. So whole world is going through a turmoil, a financial turmoil, but much more so in Pakistan. So we are trying, these are our colleagues from pharmaceutical. They represent the top pharmaceuticals of Pakistan. They export to, I was just telling Dr. Uppal that they are exporting to more than 36 countries. Pakistan quality is very, very high standards. They are PICS enabled, they are WHO also certified, many companies, and they produce, world-class quality drugs at a very affordable rates. So they are already doing a great job. Today, we thought Pakistan Society of Internal Medicine will host this discussion that what we can do for them and what they can do for us and the patients. So, we meet somewhere midway and we ask the federal government, provincial governments to take these 4, 5, 7 steps. Another important thing that I like, because this is a rare opportunity to get all these joints in, is that Pakistan, although we call ourselves manufacturing industry, but we all know the fact is we are a repackaging industry. We are not making many raw materials in Pakistan because obviously our pricing has gone up, our cost of production has gone up without the dollar and the fuel cost going up. But still, I think that's most important thing. And the third very important thing is the government, whichever government, all the governments even need to get together. We do not have a single biotechnology plant. So we are reliance on biotechnology products like insulin, like heparin, like erythropoietin is very, very high. So Pakistan will be the third largest country in the world in year 2042. India next door, unfortunately for us, fortunately for them, they have about 300 plants now. Biotechnology China have more than 3,000 plants now. So we rely totally. I know it's difficult. People don't want to take a risk, but I tell you, when one biotechnology plant will start, I think we will see mushrooming of so many. It's just breaking the ice. And probably they need all the support from the government to do that. But I think all the governments are here tonight, here in this hall, so we can look into this. Thank you.
There has to be a change in the program because we have an international event which is going to be online with our faculty in UK. It's on women leadership, but Professor Javed Akram wants the honorable representatives of the pharmaceutical industry to respond to his comments very briefly, and then we go on to the Women in Leadership program. And then we will resume this dialogue because it cannot be rushed. It is of great national significance, and it would be unfair to all of you and the minister, federal minister, to rush this. So we are going to have your comments briefly, break the session for Wilmet, and then reconvene for this. Thank you.
Yeah, so spotlight is here. So I think I just have a comment about, as you mentioned, biotechnology and related products. And yes, I think the need is going to increase, be it conventional medicine or internal medicine, be it oncology or whatever the case may be. But I think expecting from the pharmaceutical industry to sort of invest in this area in these times is it's not impossible, but it's near impossible. And the basic reason is that we all know it's not just about dollars and cents, but it's about talent, it's about technology, and Pakistan does not have that talent at the moment to sort of set up these kinds of biotech high quality manufacturing facilities. It requires a significant level of R&D, to the fact that I would just like to correct one statement with all respect, Javed Saab. Pakistan pharmaceutical industry is not a packaging industry. It is a research and development oriented industry. And the reason being is that it doesn't just require medicine or APIs to put them into a tablet pressing machine and make it. There are certain tests that are required. There is a comparative dissolution profile which is done against the innovator to find out if the product has the same at least bioavailability or not. yes, we don't have bioequivalence in Pakistan. And I think I would like to sort of bring the key decision makers, whoever are here, is that the pharmaceutical industry pays 1% of their profits annually as central research fund. And we've been paying that for, I think, since the industry existed in Pakistan. Unfortunately, that 1% central research fund has never been put to any use, at least not that I or my colleagues here are aware of. And I think to start with, we could look at the utilization of that CRF in setting up a government-owned R&D facility that could at least start looking at producing APIs in Pakistan. I'd like to give you an example of Thailand, which is a country not very different from us in terms of economy. I'm not going to give example of India or Bangladesh because I think they're already in the next orbit in pharmaceutical technology. But I think in Thailand, they have called government pharmaceutical organizations, or GPOs, which are government-funded pharmaceutical companies. And the government is there basically investing in the R&Ds and making them vertically integrated, so as, you know, which is the lingo that we use in R&D. So I think the long answer to your short question would be that it has to be a government and or what we call as public-private partnership that needs to be sort of looked at. The CRF utilization needs to be done. And I think you want me to stop now.
I can't say that, sir.
The other point that I wanted to make very quickly was that there is another way, and I think my colleagues here would agree with me, is that we can't do biotechnology in Pakistan, but we can surely do the fill and finish, which is step 2 of biotech, and we can export it from Pakistan. And through that, we could bring in that hedging that is required, which is in another way, it's not the solution, but it at least it's one way, which is a logical solution. So that's pretty much it.
So thank you very much for giving us the way forward. I will now break and request the honorable guests to remain seated here for the next session. I will invite Khadija Munir to take up the session because our faculty in UK is online and they are waiting for this session. She will introduce and carry forward. She has been working extremely hard for this session.
Assalamu alaikum. Good evening, distinguished guests and esteemed colleagues. As we gather here today to delve into the remarkable journey of women in healthcare leadership, I am reminded of a poignant saying by Florence Nightingale, the founder of modern nursing. She once said that I attribute my success to this: I never gave or took any excuse. These words resonate deeply into the context of our today's discussion. Today, we embark on a journey to explore the achievements, challenges, and aspirations of women who have broken barriers, shattered glass ceilings, and continue to pave the way for a more inclusive and equitable healthcare landscape. So let us commence our journey and discussion with reverence for the past, appreciation for the present, and a shared vision for a future where women's voices and leadership in healthcare are not just acknowledged, but celebrated and embraced. Welcome to this transformative dialogue of women in healthcare leadership. Now, to offer their unique perspectives on leadership, let's invite our panelists. I would first like to invite Professor Dr. Shabeen Naz. She is the head of Department of Obs and Gynae at ISRA University. She is a member of multiple societies and projects. She is a joint secretary of Diabetic Association for Pakistan and coordinator of Women and Health Project Diabetes in Asia Study Group. She is also a member of the governing body of Health Research Advisory Board of Pakistan. She is serving as an executive member of the academic committee of the Society of Obs and Gynae. Madam, please join us on stage. Next, I would like to invite Professor Dr. Shaila Javed. She is an inspiring personality due to her diversified qualifications and professional attitude. She is the pioneer in private medical hospital, Akram Medical Complex, since 1985. She has been at the forefront of women empowerment initiatives, with one of her most prominent contributions being the approval of ECOSOC, recognized Women Chamber of Commerce and Industry in Pakistan. Madam.
I'm sorry, Khadija, for interrupting you with this introduction. It's my pleasure to announce that the chief guest has arrived. Dr. Nadeem Jan is here amongst us. We, because of the constraints of time, have already started the next session, which is on women leadership. And we are very honored that you will now participate in this program. And then we will continue with the open mic session, for which the industry represented by owners of some very important companies like Getz, Searle, Feroz Sons, and HiQ are here. And they have been very patiently waiting. But now you will have to wait a little more, sirs and ma'am. She was also amongst the panelists in the pharmaceutical industry representative, because our faculty in UK is online and they are waiting. So Khadija, please continue. And I'm sorry for the interruption. And I welcome you, sir, here amongst us. Thank you.
Thank you, sir. Next, I would like to invite Dr. Shabnam Naveed. She is a physician, medical educationist, diabetologist, and researcher, currently serving as Associate Professor of Medicine at JPMC Karachi. She is a supervisor fellowship program CPSP Karachi. Her areas of interest are research in liver diseases, diabetes, and hypertension. Madam, please join us on stage. One of our panelists, Dr. Shabnam Sarfraz, has joined us online. She is the Global Director for Gender and Health WHDH, Senior Advisor for Health Systems and Policy Research at P2 Impact Associates and Member Social Sector and Devolution Planning Commission, Government of Pakistan. She is one of the inaugural 2019 Women in Global Health Lead Fellow at Harvard University. Her work focuses on health systems, management, and policy reforms, and she has managed large-scale, high-impact health projects while working with the government of Pakistan and partners such as DFID, USAID, and WHO. Thank you, madam, for joining us online. I would now like to invite a person who is known for his leadership. We know that true leadership knows no gender. And in this session, our co-chair exemplifies that. He stands as an ally, recognizing the path to progress in healthcare leadership is paved with unity and equality. I would now like to invite Professor Dr. Aftab Mohsin, who is a graduate of Nishta Medical College. He became a member of Royal College of Physicians UK in 1988. He is currently chairperson board of management Gujranwala Medical College and Allied Teaching Hospitals Gujranwala. He has published extensively nationally and internationally. He is also serving as a senior vice president of Pakistan Society of Internal Medicine. Ladies and gentlemen, it is an honor to have Professor Dr. Javed Akram, our esteemed health minister, chairing this session on women in healthcare leadership today. His presence here symbolizes a commitment to inclusivity and a recognition that strength of healthcare leadership lies in diversity. As we explore the pivotal role of women in healthcare leadership, Dr. Javed Akram serves as a beacon of support and an advocate for gender equality in healthcare. His leadership underscores the importance of collaboration and collective efforts to ensure that women have equal opportunities to lead and shape the healthcare landscape. Sir, please join us on stage. Thank you. So first of all, I would now like to invite Dr. Hina Latif for her talk on emerging women leadership. Dr. Hina is Assistant Professor of King Edward Medical University, Lahore. Thank you.
Thank you so much, Dr. Khadija. I guess Dr. Mumtaz Patel is on line already and she's waiting for the session. So we would like to have Dr. Mumtaz Patel over here, and she is VP Global, Royal College of Physicians, England. Dr. Mumtaz Patel. हाँ जी, Dr. Mumtaz Patel. वो online है, वो online है. So would you like to take over?
Okay, now I would like to invite Dr. Mumtaz Patel. She is a consultant nephrologist based in Manchester, UK. She has joined us online. She is a postgraduate Dean Associate for NHS England and has recently started as Vice President for Education and Training at Royal College of Physicians, London. I would like to invite Dr. Mumtaz Patel. She is a consultant nephrologist based in Manchester, UK. She is a postgraduate Dean Associate for NHS. Okay, England, Dr. Mumtaz, can you hear me?
Yes, I can.
And training at Royal College of Physicians, London. I would like to invite Dr. Mumtaz Patel. She is a consultant nephrologist based in Manchester, UK. She has
Can you hear me okay? Okay. I hope you can hear me okay, Soumya?
Yes, madam. Can you hear me? Yes, can you hear me?
I can hear you. Can you see my slides and myself, I hope, on the screen?
Can you please start with your thoughts on the Global Women Leaders Program?
Fantastic, lovely. Thank you so much. So thank you, Khadija. Lovely to see you. Okay, Soumya?
Yes, madam. Can you hear me? Yes, can you hear me?
I can hear you. Can you see my slides and myself, I hope, on the screen?
Can you please start with your thoughts on the Global Women Leaders Program?
Okay, thank you so much, Khadija. Sorry, there's a delay in the transmission, so that's why there was a pause from my side. So thank you so much for inviting me. Sorry I can't be there in person, and nice to see you all in the background. Khadija was one of our participants, so lovely to see you, great leadership skills, and some of our champions and supporters for the program. So I'm going to talk through a little bit around the background of the program and then what we've done so far in Pakistan, and inshallah how we're planning to take forwards the program going forwards. I think I've got about 10-12 minutes or so I'll hope to keep to time, and then we can bring the other participants in as well. So the scale of the challenge around global women leaders is huge still. And I guess a lot of work is being done at the moment, and we're part of that kind of journey. But we know that women make up over 70% of the global health workforce, but only a small proportion, 25%, hold senior leadership roles. And that percentage goes much lower down to less than 5% in low middle income countries. The academic role side of things is even lower, and this is the same issues in the UK and the Western world of around 15% of senior academic roles. What are some of the barriers and enablers? We know that gender leadership gaps are driven by work-life balance. I'm a mum, a wife, and it's hard work trying to balance everything with a high-powered career as well. Then stereotypes, discrimination, whether that's overt or covert, power imbalance, privilege, all these things impact. And these disadvantages are impacted by multiple other identities, whether that's social class, race, gender, and other protected characteristics as well. What helps? We know flexible working arrangements help. I worked flexibly as well during my training, and those things help. Mentorship programs, formal policies on gender discrimination, harassment, enable advancement. And why is there a need of change? We have Shabnam here, big, sort of advocate for global health